Well, hello, Dr. Rafael Rocha. Today we'll interview you about diabetes type 2, mellitus type 2. Let's begin with the first question. What is the etiology of this disease, diabetes mellitus type 2?
Okay, in diabetes type 2, we have to say that it's triggered by resistance in the insulin in the body. So the main cause in diabetes type 2 is bad eating, lack of exercise, and probably genetic factor 2.
Okay, how serious is this disease, diabetes type 2, and how does it affect a normal person life?
It's pretty serious because it affects all the lifestyle in the patient. It affects the physic requirement, and maybe it affects mental health and psychological health too.
Okay, what is the treatment for diabetes type 2?
The first treatment is doing exercise, eating healthy. Then, depends on the diagnosis, we have to prescribe hypoglycemic agents, or in most severe cases, intramuscular insulin.
Okay.
What was the patient's chief complaint? Why did he come to see you?
Well, the main complainant patient is headache, a lot of thirst, hunger, weight loss. I think that's the three main symptoms.
Okay. How are symptoms the patient can have?
Headache, stiffness, paintings, thirst, hunger, muscle ache,
Okay.
and that's it.
How was the patient tested for the disease, and what did the test reveal or said?
How you can know he has diabetes?
Yes.
Okay, we have to request a blood analysis, blood test. In that blood test, we have to see the fasting level of glucose.
Mm-hmm.
And if we have some doubts, we have to run tolerance glucose for diagnose diabetes.
Okay. What will happen if the patient does not receive the treatment, the correct treatment for diabetes?
Well, the patient may have hyperglycemia crisis, coma, ketoacidosis, and maybe sudden death.
Okay.
What treatment did the patient receive, and how effective it was? I mean, how do you have like a medicine on how effective is the treatment you gave?
Well, diet and exercise have an effectiveness of maybe 70 to 80%. There's some scientific proofs that indicate that if a patient lost 10% of his body weight, we can improve the insulin resistance and maybe get a cure for diabetes type 2. For instance, the insulin resistance. Then we have the hypoglycemic agents that have an effectiveness of 80 to 90%, and insulin that have an effectiveness of 100%.
Okay.
What new techniques or
New methods?
yes, do you know for preventing or treating diabetes type 2?
To prevent diabetes, the best method is a healthy lifestyle, doing some exercise, eat healthy, and that's it.
Okay.
New treatments, we have the subdermic implants with progressive insulin release, and I think that's all.
Okay. To end with this interview, do you have any family member with diabetes?
Yes, I think I have one uncle with diabetes type 2, and
How it has
Yeah.
been his process of treatment?
can you repeat the question? I didn't hear.
How it has been his process for treatment against diabetes?
Well, at the beginning, he have a very difficult time because he didn't take the treatment in time.
Okay.
So we have a lot of complication, but then with right treatment, his lifestyle improved a lot.
Okay, we thank you a lot for your time, doctor, and we hope to see you later soon. Thank you for your time and for your good knowledge.
Anytime, you're welcome.
Thank you.